That sounds a little high.
That's closing in the carport, adding the bedroom, and making the front porch.
You can build a whole new house for that.
Hey, Jerry.
All day long. Ship does it all the
Now
time.
you should be able to hear.
What the bid was for.
You can buy a new house.
No, it's not that.
I can get one of these little block houses.
I think it's on because I can hear
Y'all
myself.
be built for less than that.
I just
You
got
could
it on.
build, you could get a whole new,
Just cut it on.
a double wide
Just
trailer
cut it
moving
on.
in there for Josephine to live in for that much.
Well, you can go to the bank and buy a new house.
Yeah. Guess I need all my candy.
It'll all work out in the wash.
Oh, it'll work out.
Just get married, Richard. That'll fit all.
But talk to Nick when you talk to him. Done a bunch of
I hope so, because if it don't, what am I gonna do after that?
share. Come on, buddy.
I worked on my son's house, and I said, David, this is going to be 5. And it went right on by 70.
Well,
Test.
depends on the finishes, you know, and the appliances, and but with his, it's just.
Well, we
Test.
Closing in the carport and then, because
You can hear it?
actually, I'm doing all that right now out of pocket.
We didn't.
Wow, it seems high.
We didn't do a bid. We did it, and then we.
Either that or you're gonna take it all by hand.
Right.
Run away from you, won't it? We didn't stop.
I just got those things.
I got $60 a square foot in my house to build it. That's the whole house. Appliances, septic tank, everything.
That's about what I built mine for.
Like I said, the bathroom I just got totally redone, and I'm in the process right now of doing the kitchen and utility room and all new appliances, but I'm doing all that out of pocket. You know, and you don't have to worry about that.
You should easily be able to do what you're trying to do. That's right. And if you do the work, coordinate the work yourself. And it's economy of scale too. The bigger the house, the cheaper per square you do.
We did a lot of our own work, driving the nails.
I pick up every one of them blocks in my house.
Hello.
Hated it.
We'll start just as soon as Greg gets ready.
Oh, thank you. Tommy had it.
Hey, Randy,
There you go.
He had it a couple
Randy,
days before
if I
Tom
could
got it.
just get someone just try it in.
Okay,
do the
that'll be
Excel,
good.
I can take it from there.
Okay,
Nick.
thanks. Bye.
And just get somebody just to dry it in and let me finish the rest of it, because I can do sheet rock and all, I can't frame it.
Talk to Nick. He'd be the one to talk to.
All the exposure we need.
$185 a square?
Good stuff.
Well, you're on Highlands too, right? Yeah, that throws it way off.
I need to have the start.
Highlands add $30,000, $40,000 to a job, easy. At least, maybe it's closer to 50.
Well, I didn't figure my square footage in the lower level.
I think mine's under roof too. Heat and cool will be higher than that. Buddy?
As soon as Greg's ready, we'll go.
Waiting on Greg. No rush, Greg.
Go ahead and put the PowerPoint up there, please, ma'am.
At the corner, where you park over. Hey, we need to buy a
Cool.
faster computer in our budget.
Yeah.
There you go.
I thought we, that's right, there you go. Already starting. Look.
This is the first or second one, David?
Okay.
This is the first
Got it.
shot.
All right, bye-bye. I can never.
This is, she's using this one for the workshop. The other one for...
Take the cap off a roll of batteries around, David. That works with my TV remote sometimes. Why is it a name?
Say, they have a hammer, everything looks like a nail.
Oh, never mind. Never mind.
Mary Dean, how's that new baby doing?
Oh, right there.
Yeah.
Mary Dean, how's that baby?
She's wonderful. There you go.
Is she, huh? The second girl or first girl?
Second girl.
Girls
All
aren't
right,
expensive.
I've got 3 o'clock. We're ready to call the meeting to order.
All right, very good. This is the first meeting of the 2015-16 budget. What this is supposed to be a free and flowing conversation. We've got a small PowerPoint presentation to present to you guys, and there's no hard numbers at this point on anything. This is just to open up the budget discussions with us as well as staff and constitutionals. The first slide, in preparation of the 15-16 budget, we included, it basically is based on the 5-year plan as the foundation of our budget. Realistic assumptions were made in order to develop the 5-year operating plan and budget. These expenses were, we had a set amount for increases in electricity and fuel, etc. Those will have to be tweaked a little bit due to the fact that fuel has actually come down. To look at that, that's a little scary thing. But other than that, operational expenses were pretty much set either at flat or just like a 1% increase in the majority of the funds. The assumptions are consistent throughout the 5-year operating plan and the budget, with some exceptions. Those assumptions for personnel expenses in the budgeting process, 15 and 16 and 16 17 assume a % increase in personnel expenses with no increase in the number of staff. Really 1% about this year, but as you know, we have in April, we'll be coming to you guys in the last meeting in April. We've got to see where our mid-year numbers are, and we'll be coming to you guys to discuss the possibility of giving a raise for all of our employees based upon how the mid-year financials are. FY 17-18 through 2021 assume a 1% increase in personnel expenses. That's in the 5-year plan. Health insurance. This is one of the biggest keys that we have to do to be able to control our budgets. We're assuming that health insurance costs increase, that it will continue to increase. And last year, it had an 8% increase in 13-14 to the current fiscal year. We're proposing that we cap that increase at 5%, and we've applied that to our 5-year plan. Cap and increase will give stability to the unknown. The rest of that 5% the rest of the balance has to be made up by the employee. It's becoming more counties and municipalities are doing this as a way to be able to control the control cost, as health care is continuing to be a big problem, and we have a problem budgeting health care. So we feel like that this is a good 5% is a good number to hit. The county will cover the 5%, and we're proposing that the employees cover the remainder if it comes in over 5%.
Has anybody ever found out why our loss rate is so high? I mean, that's what's really killing us, isn't it?
Well, that and just in general, health care is more expensive.
Right.
So, and like I say, it was 8% last year. We have no idea what it'll be this year. Don't know about the increase or anything. It's way too early for that.
I want to ask a question about that. So you were saying that what you're planning is that we would pay the 5% and the employee would pay the 95%?
What? No.
Is that what you're?
No. If there's an increase, we will pay up to the 5. We'll cover the 5%.
Mm-hmm.
But if it's a 6% increase, the employee has to pick up that 1%. Realize what they have is on health has CHP.
Mm-hmm. Okay.
Okay. Not every employee. So there's a bunch that don't have CHP.
Mm-hmm.
So they're being penalized by folks that do have CHP. So, but that anyway, that's a proposal. You guys can look at it and say yay or nay, but that's what we're assuming. And they have to do something to be able to control these costs in some form or fashion, because it's getting out of control.
When will we know those numbers?
That won't be until June.
And
if then.
And if we consider bidding it again, at what point will we have to do that?
That would be in June.
Okay.
Yeah, I mean, we've looked at that in the past, and the problem is you know, you get a 1-year grace period, and then they hit you the next year. So,
right.
But that's something that we found out that this is probably, and also talking to a lot of other county managers and city managers, this is something that everyone is going to a capped they're capping what they're paying, and that's it. And because you don't have, not all employees are on CHP or on insurance.
It helps us on the budgeting
Yeah.
side, but then we're also putting an additional burden on the
Extreme uncontrollable expense.
The thing I would hate to happen, for it to work out to where that we capped it at 5%, and then the 2%, and it ended up being that the employee's check go down.
And that's a possibility. But we got to look at a realistic assumed expenses and what we can do to control expenses. And this is something that after a lot of research, and there's just really, I mean, in looking at the budgeting moving forward, this is one of the things that breaks the bank. But it's only for a portion of the employees. Not all employees are on CHP. Yes, sir, Dr. Kessler.
Thank you. So what amount of money does the 5% of the premium represent per employee?
It varies based upon what plan they're on.
Yeah, just...
But hold on, I can tell you. Hold on just a second. Just in the BOCC itself, this is just the BOCC. We spent in health since we expended $721,000 last year.
Give me that again.
721,000. Excuse me. That'll be for this year.
That'd be roughly $35,000 a year we would allocate to increases.
Right.
When you say just the BOCC, who all does that include?
That's just the Board of County Commissioners. That doesn't include the constitutionals. That's everybody but the constitutionals.
And our cost was how much?
$721,000.
And how many employees what does that break down to employee?
Well, it ranges. And
Well, it's an average though.
an average runs about, I would say about $8,000 an employee, something like that, maybe.
So in
I
other
haven't broken it down that way because not everybody's on it. Some people on a higher plan, some people on a lower plan.
But the overall average, that's an $8,000 above the... Is there a way that we will pay a percentage of their cost, whereas not this percentage of increase, but let's just say that we have our employees and we say we'll cover 50% of your cost.
We currently do that based on, we pay a percentage of each category.
But you're saying you're going to pay a percentage plus you're going to also...
No, we're paying a percentage. That's right. But what we're saying is any increase that's over 5%, the employee we'd put it on their.
Why would we not split that 5% increase? Let's just say we're paying a 50-50 share
Right.
of the employee's insurance,
Mhm.
and it goes up 5%. Why would we not? Why would we cover above 5? Why wouldn't we just split that 5?
That's up to you guys. If you want to do that, I'm recommending let's just do it at 5%, and then anything over that employee can do that. That's up to you guys if you want to do that. You can make that suggestion. Yes.
Howard?
Thank you, Mr. Chairman. So, as far as bidding this out, my opinion is, in this region, we're really locked into CHP if we want to go with trying to get a price in our health care. And the reason for that is, if we don't use CHP, my impression is a good percentage of our employees, family doctors, and surgeons, etc., are in CHP, and they'd have to then sort of give up those doctors, and that's a really big hassle. Wow. So they got us over a barrel over here. And, you know, as far as their rating is concerned, it is one of the highest in the country as far as the type of HMO management they're doing, delivering bang for the buck. And there are all kinds of plans out there, though, with higher deductibles, and I think people are starting to notice that when they go to the doctor's office or wherever they end up, they may have a co-payment of not $100 anymore in that emergency room, but $250, and the story goes on and on. So, but the system right now, it'd be very onerous for us to switch plans with the majority of our people being in CHP right now, and their physicians locked into those plans.
Well, also a good thing about CHP is we are blended in with, you know, so as to share all the constitutionals as well as Leon County schools and other schools, so we get the power of, it's not just us, we have a blended, so, because if we went with our loss ratio, we may get a good year first rate, we're gonna get killed the second year.
Well, and I'm not recommending getting out of CHP. I agree with you on that, but I'm wondering is there anything that our insurance agent can do or recommend that we do to improve our loss ratio? I mean,
It's actually gotten a little bit better, but the problem is you have retirees that also count into our system. So, but also part of this is 2% of this is, and Debbie was just telling, 2% of this is affordable health care, what's upcoming. They know there will be a 2% increase just based on Obamacare, Affordable Health Care Act, whatever you want to call it. That's coming as well. So that's 2%. And then we can talk about what the rise of cost in health care, and then our loss ratio kicks in. We've tried some programs with that. One of the programs that we're kicking off right now with Brown and Brown is and trying to keep it down is you guys teledoc. You'll be getting some information into where as you can call in as an employee, you can call in and talk to a doctor, get not narcotics or anything like that, baseline antibiotics, stuff like trying to keep people from going to the emergency room, from going to and that's just one of the ways we can do it. But when we have a large, say if someone has a child that has problems and they have to take them to Shands for five weeks. I mean, we pay for that. That's just huge, and that just happens. So.
What about, what percentage of an individual's insurance, what percentage do they have and what percentage do we cover at this time?
It varies based upon each employee.
Give me an average.
Before I put that out, let me make for sure. I'll get back to you on that one, okay?
The thing about it, let's just say that we pay a 50-50 percentage.
Mm-hmm.
And last year, it went up 8%. And last year it went up 8%. Then we would be splitting that 8 at 4,
mm-hmm.
which is less than the 5 that you're talking about.
Right. Well, Debbie's just saying we pay about an average about 80%.
We pay about 8%.
80% of the cost. That's right.
The premium.
The premium, yes.
Okay, even if you use that number, there's probably a way of interpolating that number into that.
Mm-hmm.
Let's just say that we continue to pay 80%. Let's don't say 1%. Let's don't say anything above 5. Let's just say we continue with the 80-20. They pick up 80, we pick up 20.
It's the other way around.
We pick, yeah.
Yeah.
We pick.
Well,
yeah,
and as I said, we can do that. This is just a proposal, and if you guys want to change that up, that's fine.
Would the 80-20 not be better than picking up above 5? Would we not?
For the employee, at least the 5% from the county standpoint, we can budget better. We have a better budget, as well as we have predictable expenditures going out in the future for our citizens, etc. The employee side of that, they would have to pick up the extra whatever's over that. I mean, insurance, it hadn't happened in forever, but it could realistically, it could come down or stabilize. If it stabilizes, I don't know. That's the question. And anyway, that's
we can't
what's
do
up to
anything.
you guys.
We absolutely cannot do anything about the insurance charging us 8%. They're going to charge us what they're going to charge.
They're going to charge us what that's right.
We can keep our ratios the same as they are today.
That's right. That's another option. That means you're basically splitting an increase.
It doesn't mean that we increase anything, or it doesn't mean that we decrease anything. It means we stay level percentage-wise where we are today.
That's a possibility, yep.
Mr. Chairman?
Howard.
Yeah, please. So the reason why we're in this fix right now is because of a couple of things. One is we have passed legislation at a federal and sometimes at a state level that bars competition in pricing. For example, on drugs, medication, we can't go out as a government and seek the lowest price. That's our legislation. And what happens to citizens and in our case, county government. So, and the other one is larger. It's corporate, free enterprise system in the health profession. And that's a big issue. I know it's very controversial, but until people start writing letters and saying that we don't want to be totally at the mercy of whatever their percentage is next year, what say do we have in that? We don't. And so they have a profit built in. No matter how poorly they run their organization or no matter how good they run it, they're still going to make money no matter what. And it's about time that the citizens of this county, state, and nation speak up.
I wanna add one more thing. David, there's no way to expand our pool, is there? I mean, we can't decide to join in with the state or anything like that, or with
As far as I know, no. I mean,
Leon
that's-
County, or, you know, maybe this is something good to bring up at the regional council where you got 8, 9 counties there,
Mhm.
to see if everybody could get together, and, because the bigger you can make your pool, the less our loss ratio matters.
Well, currently, like I say, we have all of Wakulla County. We also are blended in with Leon County schools.
Why not, just to ask you, how do we blend in with Leon County schools and not Leon County board employees?
I
Are
don't
they-
know. All I know is for sure we're in the Leon County school system. I have to find out who all we're in with.
Well, maybe I'll bring that up at the next meeting, see if there's any way to
Maybe in
explore
with
that.
all of Leon County government. I'm not sure.
Because the more people we can get in the pool, the better
Right.
pricing.
So one last thing. Recently, I wrote my view in the Tal Democrat on health care, and basically gave out 2 choices. One was a Costco model, and one was a Medicare model. And both of those models would be better than what we have right now. And Costco, you know, they're doing things now with getting a better deal with their credit cards. They're moving away from American Express, and well, why can they do that, and why can they demand a better deal? They can do it because they're in control of their own destiny, and they're huge. Just like Commissioner Merritt is saying, if we were bigger, then we could control the thing. But it becomes difficult to control the game when our own legislatures are saying, no, you have to have your hands tied behind your back and be blindfolded, now go out there and play. So even if we were to get bigger, we're still at the mercy of a lot of these things that the legislatures has put on our back.
Yeah, and that's the one good thing about being a big corporation is they can make a decision.
Are you
That's
saying,
it.
you're saying we're tied in with Tallahassee?
Mhm. Not the state, but the Leon County schools for sure, and I think the rest of Leon County as well.
What part of their elder group is pulling?
No,
They're helping us.
they're helping us actually.
They actually help us.
If it wasn't for them, we would be
They
in
probably have a
worse
lot
shape.
more older people than we have.
I don't know how all that works, but it's they actually help us.
Okay.
Moving on. Next slide, operating assumptions. As I said before, we've assumed a 2% increase in operating expenses. Those are electricity, gas. We're going to go back and look at gas as it is. Fuel is cheap change next month. It continues what it's doing. We'll obviously be able to bring down our fuel line, which we burn a lot of fuel. Then F17, 18 through 21 assumes a 1% increase in operating expenses, and that is just expenses as it relates to actual operating, meaning electricity, fuel, telephone, etc. Some individual line item departments and non-recurring expenses, vehicles and equipment have been adjusted as need is identified. Of those exceptions, airport, the HOA agreement was big. We got that taken care of, so the airport will be a net zero, hopefully, each and every year. Facilities, fuel contamination cleanup, that's something that is currently costing us $100,000 a year. It's projected to go up. We have a that's the fuel contamination right here from that you guys are aware of. Now, one of the things that we're looking at is if we can get if the fuel remediation that's going on, the fuel cleanup, we can get it to where it retreats from the well, from the Soptabis well, which is across the street. If it'll retreat back some, I'm going to come to you guys to ask to buy the property right beside us. because then what that will do is allow us to stop the fuel remediation and not have to spend $160,000 to $200,000 a year for cleaning up this fuel. If not, if it doesn't retreat, then we've got a bigger problem than that. Then we could be looking at a long-term $200,000 a year, $200,000 a year cleanup.
Why can't you just drop another well?
We could. The problem is that's Sopchoppy's best producing well, and trying to find another one, and then the well is over $1 million.
Well, it's costing us $160,000
I know, but
a year.
that's the problem is, and then it still is on somebody else's land. We got to get it back off of their land and get it onto our land, and that's the reason I'd want to buy that.
Their land being...
Sopchoppy, and then also it's encroaching in underneath the apartments over there. And we have to get it off of their land
I understand
and
that.
get it onto our land. So this is a problem that's just going to keep giving, I think. But we're going to reach a point, if we can get it to retreat, we'll reach a point to where we can back off of that, but then we got some options we'll have to take.
Do you understand the process of how we get this to retreat?
Yeah, somewhat.
How does
Not enough to explain it.
Okay.
I understand. They're injecting air in and pulling the air out. They're injecting it in, blasting it, and then pulling it back out, and it goes through a carbon filter where it collects the I forgot the chemical's name.
Fracking.
Yes, it's like fracking. It really is.
Only they're putting clean air in.
Yeah, they're
Getting
putting air
dirty
in.
air out.
Yeah.
I think, was Jerry, I don't know if Jerry was talking about another treatment well. I mean, but they're not pumping. Are they pumping and treating the groundwater?
They're pulling
stripping the
air out. They're
volatiles
pulling
of it?
air out. They're pulling the I forgot the name. What it is, it's a non-carcinogen, and it goes to this well, and every now and then you can taste a little bit of fuel taste or smell in it, but it's a non-carcinogen. One of the options is to continue to let it go, put a filter on this well to filter out I can't remember the zine, it's something zine, to filter that out.
I do understand that if it's going on past the well toward the apartments,
Right.
win, lose, or draw, we have to pull it back this way.
We got to get it back this way somehow.
And I would think the only way to get it to retreat is you make a vacuum basically by pulling groundwater
Well,
out.
the
and
biggest thing is what we're trying to do is inject air in it, and because air destroys the bacteria and also pulls it back out. We would have had to replace the media about 4 times, which is unusual.
How deep is it?
You're talking about the plume?
Yeah, contamination.
It's right on top of it's running right on top of the limestone here, so it varies. It's running right in the water supply.
And well, like I was saying, if you pump the water out, that would make it retreat. But that's their business.
Yeah, we pay some folks a bunch of money to analyze that. Probation pretrial release, as you know, we privatized pretrial release. We've actually lost a person. We were able to eliminate a position.
That's happened already?
What's that?
That has happened already?
Yes, that's already happened. So we've already moved through that. The thing is, naturally we lose a little bit of revenue, lose more expense than revenue. So we got to get that shook out, but that'll actually be a positive gain for us.
How long is that contract that we have with the privatization of that?
I don't know, Katie, how long was that contract? 3 years? 3 years? We're looking at other ways to privatize some other stuff at all possible. It's just right now, I've made quite a few moves, and this was the last on my list, and I got to figure out what's next. So, but we'll be looking at ways to continue to privatize where it makes sense. If it doesn't make sense, we won't do it. All right, and the library, Friends of the Library contribution. We'll need to continue to work on that. We've got to work with them on that. There's a couple of things that we're doing, having some conversation, and this is a prelude to our meeting on the 23rd, our workshop about the community center. One of the ways we're looking possibilities, including the library, in with the operations of the community center. If the county, if we so choose to take it over, that could possibly increase funding from the state. As you know, that's a wave funding, meaning we pay whatever we expend out here. 2 years down the road, we'll get 30% more of that spending, or whatever the state's given us. So it has a possibility of helping us out, but we got to work through a bunch of details. In fact, Miss Robin and I are going to be talking about it tomorrow, aren't we, Miss Robin?
So I have a question on the contribution. When you say the library contribution, what are you referring to?
That's just something that's just one of the exceptions that we've gotta ferret out in this budget. It's what is that going to be next year?
In your determination, you will not be increasing the
Not us, this is the Friends' contribution to us.
So,
To the library, I should say.
right, and my position on the Friends, and I am a member of the Friends, is that the Friends raise money for special projects and not to be funding the county in running the library. That's not the mission of the Friends, although we did step in when things got really difficult for the county. But I'd like to see that money dedicated to general fund cease and it become a county or
Robin, can you come up there and talk to this real quick? Let her address real quick what that she can explain it better than I do.
I can try to anyway. The money that is pulled in by the Friends of the Library is money that they specifically raise to fund specific children's programs within the library. And the reason it's brought in the way that we bring it in to spend it through the budget is so that it does count towards those state aid numbers, is the primary reason it comes in through the budget. But it isn't something that is going to be very dependable budget-wise from year to year to year. The big contribution that they have pledged right now is the $22,000 that's currently in the budget that was supposed to go towards finishing a teen room / new children's room. So that's not a number that's going to be maintained annually from them. So, on one hand it helps us out, but on the other hand it needs to be designated towards special projects, and it also isn't something that we need to be counting on year to year.
So in other words, that money's not going like to pay your salary, for example. If
No.
it went away, if they decided they didn't want to give any more, you just stop whatever special projects that was funded.
Exactly, and that's basically all of our children's programming and a small portion of our book budget.
so you'll be working on the contribution as it pertains to special projects.
That's what we would like to do.
Okay, that's fine.
Okay.
Thank you.
It looks like 22,000 is what we're currently budgeted from the
Right, and
Friends.
that was the amount of the contribution that was, we've changed what's happening at the library right now as far as the vision of which room was going to be what, but overall, these improvements are going to be happening, and that is a lump sum contribution to that end.
Okay.
Is that right?
All right, budget challenges. All right, community center will be one of those. As I said, you guys will be workshop on the 23rd. You'll be able to discuss that in detail. I gave all of you your book on the community center, and that's going to be something that could affect our budget in a myriad of ways, or not affect it, or affect it, or not affect it. From this coming up year till 5 years out or however long. That's going to be strictly up to you guys on how you want to handle that. Fine and forfeiture fund, ICE revenues continue to, every year we're concerned about them as well, so we have to worry about that. The fire MSBU fund, as you know, we talked about that. The fund is, we're having to make some shifts in the fund because of the age of our fire trucks, etc., and we're going to be shifting out capital expenditures out of the our fire MSBU fund to keep it from having to raise taxes. So therefore, that'll be going into 1 cent. So we'll have to. That's the reason we've got that here. Big Bend Maritime Center. This is just something to talk about. The Big Bend Maritime Center, I think we have a program where it'll net out zero. In fact, I think I got it where if everything works right, it'll actually bring in a little bit of profit. So, and then we have capital improvement needs. As you know, we're, and this is kind of on those capital improvement needs, we still have aged buildings that we have to take care of. We're doing a much better job than what we used to, but there continues to be a lot of problems. But also in this capital needs, we have a myriad of roads that are at or nearing failure that have already been paved. We don't have money in the 1 cent sales tax if we took every dime of the 1 cent sales tax to take care of those roads in the time period it's going to take to fix them. or before they completely deteriorate. One of the things that we are doing, though, is we're having discussions with FDOT now about expanding the possibility of their scrap, SCOP, and ZIGP programs to include more of the neighborhood roads, etc., so that we can possibly back off. But if we're not successful there, we're looking in the future of having to get ad valorem or general fund dollars to start going towards road department.
Well, then we have a, to re-up the road tax, that 1% coming up in 16, I believe.
The
sales tax.
yes.
Sales
Mhm.
And are you saying that will not provide enough money to do our roads?
No, as of right now, no, sir.
Not right now, but if we were...
Not over the 20-year life of the 1 cent sales tax, based on the allocation that we've got.
There's a portion of it that just covers our share, right?
A portion of it, 60% right now, goes to the road department. But as you know, that has been bound up by a loan program that was loaned many years ago. That we got a loan many years ago.
But now that will clear up though in 16.
That clears up. That frees up some money. But you understand, we've got a list of roads that you're getting ready to see it. It is not here, but we're bringing that up later, and it's a big list.
Will that list eat up the 1% that we're hopefully picking up in 16?
You talking about the reallocation?
Yes.
I think we can back off of the reallocation a little bit, but I think everything's going to take a hit, to be honest with you, because we're bringing in fire and having to buy $350,000 fire trucks. That's a big hit. That's going to have to. Everybody's going to have to take a hit for that one in the 1 cent.
I guess I'm not understanding, but the 1% sales tax that we will be renewing hopefully in 16.
Right.
Are you saying that will not cover the road requirements that we have?
We get about $1 million a year from
Nope.
the 60%
That's right.
allocation of that money.
That's
so,
right.
but
$1 million a
couple
year can't
miles of
cover it.
road.
No way. That's $20 million over 20 years, and we've got about right at $100 million worth of improvements to do.
That aren't gonna get done.
That aren't
Let's
gonna
be
get done.
realistic. We're gonna get...
No, they're not going to get done. What we're doing is we're trying to, like I say, we're going to be working with DOT. We found a way that where they can possibly pay for, out of the scrap, SCOP, and the ZIGP programs, they can possibly pay for some of these, and so we're going to increase our list that we turn in every year and increase the program. Also, I understand that this coming up year they're doubling the scrap and SCOP, so that's even better, and we're going to put in a whole plethora of mainly resurfacing. It'll be all resurfacing.
And I think we need to push hard too on the projects that can be used to pave dirt roads. I know we haven't really taken advantage of it in the
That's
past.
coming to you right now. That's coming to you in the next couple of months.
Because if we can help state money to help pave some dirt roads, that's unprecedented that we'd be able to do that.
We're gonna try every angle we can.
Good.
Next.
Another thing on the 60% allocation is having a different allocation for roads also.
Mm-hmm. We're gonna skip the community center portion of this because y'all gonna talk about that. This was before we.
Right before you go to that, David, I'm sorry. How is the fine and forfeiture? Where are we on that?
That's look right there.
I'm sorry. Is it basically up or down?
Well, I think I haven't gotten the latest numbers, but the last I looked at it was a little down. I think, am I right, Mary Dean? Yeah,
On
they're
Ice
down.
Avenue?
We're doing we can. Jared is on.
Mm-hmm. So anyway, that's our concern with the fine and forfeiture fund, is our ICE revenue. Currently, the beginning fund balance was $1.3 million for the fine and forfeiture fund, and according to the fund balance policy, it has about another $1.2 million to go to get to fund balance. That's according to our fund balance policy.
Now, that's the general fund balance.
No, sir.
Fine
That's
and
fine and forfeiture fund balance.
So we're $1 million and something short on that?
1.2 as of right now. I mean, that all depends on your ICE revenues, etc. All right?
So there's money that could come in between now and the end that could narrow that down.
Yeah, I hope it does.
Yeah.
All right, the fire MSBU fund, the current year budget is $1.3 million. Current annual MSBU is 75. As I said, after evaluating this fund, there's, in our operational cost, we've looked everywhere, we've done everything we can, but we just cannot, this fund cannot absorb $350,000 fire trucks. So that's the reason we're gonna be looking at 1 cent for $350,000 fire trucks.
Now, our other option, of course, is to raise the MSBU.
Well, yeah, but I would suggest taking it to 1 cent sales tax, and then we're working on a plan to raise the MSBU to cover operational cost as more of these volunteer fire departments drop out. That has happened, we're having to pick up more of a cost.
You switch the cost to the 1 cent sales tax, so of course that means less parks and rec, less road paving, less
everything.
facilities, less everything, less capital expenditure.
Less capital there is. Mhm.
I personally think that it should support itself, but anyway.
What do you mean by that?
I mean, what the fire MSBU collected should pay all expenses with providing fire municipal services.
Fire MSBU fund, with current revenue source projections, show the fund going negative at the end of 17-18. So we're going to have to do something shortly.
You know,
We'll be presenting that to you.
You know, everybody is talking about how you can't get volunteers, you can't keep them, they don't show up, whatever, and you pay them $10.
We don't, we pay them 50 now.
Yeah, what would be interesting, and I'd like to see it, just let's say Panacea, if you had 20 fires and you paid the first 4 people who came to those 20 fires $100. Now, I think you could probably have people scrambling over the highway trying to get to that fire at $100. Now, how would that relate to having an increase of, on the other side? You're trying to put an increase somewhere else.
One of the reasons we're going to be shortfall in 17-18 is because we increased it to $50. So if you increase it more,
Well,
realize it's not just every fire call. They can go to Rex, they go to this, they go to that. Our stipend number is big. Meetings, it's not a small amount of money.
well,
How much are we talking about?
would that still not be more beneficial than changing the thing and changing your direction and hiring more?
Well, and I agree with you, and that's stuff that, I mean, we're not sitting not doing anything. We've done a lot to try to fix this.
I know that.
And the problem that we're seeing is nationwide. It's not just here. It's tough, and money doesn't solve that problem.
I'm not sure it doesn't.
It doesn't.
Has any fire department ever paid a volunteer $100 to go to a fire?
I couldn't tell you that.
Well, that's why I'm saying
You know,
somehow everybody's operating by the standard operating procedure.
Well, after a point, it gets also to where you can pay that person to go $100, and they go 5 times a week, 10 times every 2 weeks, whatever that is. All of a sudden, we could pay somebody to be down there cheaper than that.
All I'm talking about is let's just say the first 4 people that showed up. You need 4 people there, so you pay the 4. I'm just saying.
That's $400 on one fire. Sometimes we have 2 or 3 calls a day.
All this started, go ahead, Howard, go ahead.
I understand what you're saying. You got to think about it. It's not just a 1 fire a month. This is a.
I understand, but if it costs us $1 million to put on a different system, how does the two relate?
We'll answer all those questions. I'm trying to find the stipend in here.
Well, you know,
20.
I would agree with Commissioner Merritt in that, you know, we're in a new area. If we're not going to be able to go back to a larger participation with the volunteer fire departments, if that's the case, then we need a predictable model for the county. And at what point does paying those stipends become paid firefighters?
Exactly.
So I think having a more predictable model is
well, and that's the problem as you think about it. Okay, well, let's pay a stipend, all right? They can respond, as the sheriff can tell you. They can respond 3 or 4 times a day. And next thing you know, we've paid out. We're paying people in cash.
Well,
a bunch of money.
You
Not
only
in
pay
cash,
the
you know
first
what
2
I mean.
people. If you need 2 people at a wreck, you only pay the first 2 people who show up.
Well,
Yeah, but after you show up number 3 or 4 times, you're gonna quit showing
you're
up.
going to quit showing up.
Or number 3 will
Or
Trying to
number
get
3 will
their
quit,
fast-
or then we'll get in a lawsuit because he had responded and he ended up helping put the stretcher in and we didn't pay him and he's, next thing you know,
When-
we got $50,000 budgeted this year.
When
for
the,
stipends.
when the salaries went from the general fund
doubles
to the
what?
MSBU, how long ago was that, roughly? And I assume it's been going downhill since that time? It's been slowly chewing into the fund balance, Greg, is that correct?
Yes. Yeah.
Okay. Now, we all need to understand too, I think, and Greg, correct me if I'm wrong, when we switched it from
2009, yes.
when we switched it from the general fund to the MSBU, we helped keep the millage rate down, right? Because that's money we didn't need ad valorem taxes to pay firefighters for because we're paying for that MSBU. Is that a correct statement?
Correct.
So it's kind of been subsidizing the millage rate by putting it under the MSBU. But we've been generating a little less than what we need every year, right? So we've been chewing into the fund balance to make up that difference every year. Now it's finally catching up with us. If past boards had have set the MSBU just a little higher, we may not have chewed into that fund balance. I don't know, but my personal opinion is kind of like garbage that you pay. The $196 pays for your garbage service for Wakulla County, and ad valorem taxes don't pay for it. I think the MSBU for fire should be the same way. Whatever it is, and it's your job to make sure they're not overspending and it's a realistic number, and I would support it personally.
Yep.
Here's a quick history on the rate. In 2006, the board went from $35 annually to $65, and then in 2011, it went from 65 to 75. So you've only had 2 increases.
What was the study?
135.
I don't remember.
It was like
135 or
something like that.
190. It was 135.
191 is what the study said.
191 was what the study said.
So we've been basically subsidizing the millage rate, keeping the millage rate low, just like we've been doing with the jail bed revenue, by the way, keeping the millage rate artificially low by using other revenue sources. And I think if it needs to be 80, I'd vote for it to make it not have to take out of the 1 cent sales tax, and we can use that money more for parks and paving and whatever. Anyway, that's just my opinion.
Well, it might have to be significantly higher than
Whatever it is.
Yeah, whatever it
His
is.
job is to make sure the number's accurate and not something the chief says, I gotta have this, I gotta have that. David's like, no, you don't have to have this for that.
Well,
No
and
offense.
we've cut the bleed down. It's not bleeding as bad as it was.
Yeah.
Now, what about capital expenses? Because that's come out of 1 cent sales tax
And
for years.
that comes out of, well,
No, capital expenses for fire had traditionally come out of the MSBU. He's wanting to switch it to 1 cent sales tax and take it out of MS. David?
Disagree with that.
Mhm.
I'd rather keep, if it's fire, if it's whatever it's for, stipends, capital expense, operating expense, the MSBU fee should cover it just like the garbage. Now, that's just my opinion.
If you buy the fire truck out of some other fund, you've just juiced the system. You've neglected the system that you just set up. You said we don't have enough money in it, so we're just going to buy the fire truck from somewhere else.
Right.
Mhm.
But haven't we purchased vehicles also out of the 1 cent sales tax?
Yes. But through 4 departments that don't have, like the sheriff doesn't have an MSBU for,
Right.
so he can't say, I'm gonna pay for my vehicles out of MSBU. We have to pay for his out of 1 cent sales tax. Parks and Rec doesn't have an annual assessment to pay for Parks and Recs. So, neither does road paving, by the way.
I'd like to see us separate out, so they have a category and EMS has a category.
Well, that's what's going to have to happen, because like I say, it'll affect everybody, because we also got ambulances, they got vehicles they need to replace, we got ambulances, fire trucks now, and because we got aged fire trucks. And like I say, we're reaching a critical point there. Next is Big Bend Maritime Center.
Hey, Howard,
Oh, I'm sorry, Dr.
Yeah,
Kessler.
it's not just a simple choice of out of the 1 cent sales tax for sheriff's vehicles, it's also out of the general fund for sheriff's vehicles.
Mhm.
Okay.
All right. Moving on to Big Bend Maritime Center. Right now, we contribute $6,500 a year to supplement the income from the annual Mighty Mullet Festival to fund the utilities and minimal maintenance. If revenue, basically, what you need to know out of this is I'm going to be presenting to you guys a program that simplifies it.
You got that
and
one figured out, right?
Got it all
Let's move
figured
on.
out. This one, that, if they're all is that easy,
What does the Mighty Mullet Festival bring in?
Not much.
Probably negative.
you know the answer to that question, Dr. Kessler.
I do, I just want to hear the answer.
Nothing to
Okay.
speak of.
All right.
So that's a pretty good supplement.
All right, capital improvement needs. Newport Park is where I want to spend some money, and let me tell you why. Currently, I know it doesn't sound like much. Last year, we collected $26,508 in revenue. This year, we're on a pace of about $35,000. I want to increase the amount of spaces we have there. Because right now we're running a 56% profit margin.
What's the septic capacity over there?
We'll make it work.
It'll
We
have
got to
to
add
be-
to it. We got to add to it, but we'll make it work.
That's actually out of the performance-based septic zone.
But this is anything I can add that brings a 56% profit margin. We need to add to that.
Once you get over a certain flow, you got to do it different anyway. And that has its own water system, right?
Yes, sir.
Public water system.
So how many, what kind of an increase are you looking at?
We're looking at about 10 spots.
And the bathrooms are okay over there?
Bathrooms are, yeah, but we're going to need to do a little bit of work there to revamp some
They used
stuff.
to be bad.
Yeah, but it's a lot better now. We've got a really good caretaker.
Yeah, I was fixing to ask, what's the status of we got rid of that old modular building for
Yep, we've got
school
a
classroom.
regular camper. A guy lives in his camper, happy as a clam. He watches over the money just like it was his.
Good.
And we've got a really good system. But also that's where, as I said, our expenses won't necessarily go much higher, but our revenues will go. So that's the reason we need to capitalize on that, and we're getting tons
Just
of
out of
traffic.
curiosity.
We're actually turning away, over the weekends, we're actually turning between 4 and 5 campers away a weekend.
Just out of curiosity,
Yeah,
is
we're
there,
at capacity.
is there anywhere else that we could do a model like that? Does South Chappie, for example, do they have
South Chappie
slips?
has they they don't advertise it nearly like we do, but they have a hookup RV park.
Now, do we have a dump place there, or do
Yes.
we have actual hookups for each
We have
individual?
a dump and actual hookups.
Okay, that may make the difference, having the actual hookup. But anyway, if
South Chappie's got a few spots as well.
anytime we can do something like that and
Got
actually
over 30.
make profit, because these people that come, the people that stay in those campers spend money in this county, too.
That's right. Oh, yeah. Yeah.
With all due respect, when the private enterprise figures that the benefit is there, they'll do that.
Well, they have the holiday campground and all that other stuff, but I guess that's just 'cause it's around the river. and
Well,
we
it's
happen-
98, it's right there on the river, and
Yeah.
we've got a...
We happen to own that property,
That's right.
is the killer thing.
A lot
Uh,
of hunters will camp there.
Yeah.
while
I
they're
can, I can go along with expanding that one we got. I probably wouldn't go along with building a new one because private enterprise can do that when they figure that's,
But a 56
Benefit.
profit percent margin, Marvin?
we should
I'll
not be in
expand it
private
all.
enterprise.
I'll pump money into
We
that.
should not be involved in private enterprise.
I know, but we already are, and I gotta make the best of it.
Well, on that one, I
Right.
have no problem with that.
Right. 1 cent sales tax scheduled for expiration on December 31st, 2017. As you all know, it's critical. The current allocation, 1.1, road goes to 60% of roads is 1.138. That's this year's budgeted numbers. Facilities, 284,000, and parks at 94,841, for a total of $1.9 million, is $1,897,000.
When's that going on the ballot?
That we're gonna come to you guys with a proposal to put it on the ballot, the presidential primary in 2016.
Primary.
Where is your recreation budget come in? It's coming up?
$94,841.
Does that give us a second shot if it fails in the
Yes.
general?
Mhm. Now, of that $1.9 million, $591,000 is already committed between the courthouse loan and the road loan.
Now, the courthouse loan is gonna be paid for pretty soon.
At the end of this, in
All
2017.
the loans related to the 1 cent will be paid when it expires.
So we'll have a whole bunch more money to
If
work.
How
it
about,
passes.
how about the 50,000 that we currently pay the other note that's for the courthouse? That continues, doesn't it?
There's another portion of the courthouse loan that's paid for from a court fee, and those court fees are down, and so the 1 cent is supplementing the payment. So So if those, it depends on what the court fees do, that's $50,000 a year.
What is the payment on the courthouse system right now? What do we pay on that?
On this side,
What is that, what fund that, 317 now?
under $200,000, I think it is.
Nope, that's public safety. They set this up different last year.
Facilities.
Yeah, I know, it switched it. Alright, we got here.
Are we using facilities out of that 1 cent sales to pay, to supplement the house? Is that what you're saying?
No, there's
A loan payment.
two loan payments.
Okay.
When we borrowed, $2.5 million, I think 1.5 is being, the promissory note was 1 cent sales tax. $1 million was the court fee. And so we're paying two portions for one payment. And the 1 cent sales tax is pumping in a little bit more than it was anticipated to because of the court fee.
Gotcha.
That number, Commissioner Moore, is $292,994. Might say
Okay.
293.
Our notes that's gonna be paid off 15, 16, or 17, or whenever, how many dollars will that free up? Now,
$292,994.
how much?
$293,000.
So that's all of our notes. Now, I'm not talking
No,
about that one.
that's just the courthouse.
No, what are all of our notes?
All of our notes, $91,000.
And they'll be paid by 17?
Mm-hmm.
All right, beginning basically in 17, we're gonna have 500 and so many $1,000 available that we don't have today.
Mm-hmm.
But you still have the same revenue, $2 million a year.
Yeah, but we're fine enough, but we have 500,000 less expenses. Right.
Mm-hmm. That's right.
Because you're gonna spend it somewhere else.
Unless it doesn't,
It will free up funding. And that's what we're working on now, is once we get that, how to keep the allocations the same, but break it up some.
David, I want to ask a question whenever he gets...
And I know where you're
My
going.
deal is, don't create programs to spend that money.
Oh, we won't. We're not.
and all this is assuming that it's gonna pass, by the way. If it fails the referendum in 17, there will be $0.
We all go
freed
back
up.
and we scratch our
Yeah,
head.
the thing,
We can't even raise ad
Right,
valorem
yes,
high
ma'am.
enough to make up that loss.
Oh.
hey, Mr. Chairman, I'm gonna- hey, Dave, I want to ask a question. I know we're doing everything we're doing at Azalea Park with the trail, which is looking really good. We're gonna be expanding, you're talking about expanding, Newport Park because of its revenue, but what long-range plan do we have to put money into our actual recreation park, where the baseball fields, the softball fields, and the soccer and everything? Because a lot of families bring their kids out
And
there
it's in
every
very-
evening.
very poor condition.
It's in very poor condition, and a lot of these families they're traveling around doing the travel ball, and they're going to other areas, and they're comparing pretty much, and I get a lot of calls about what are we going to do to improve our park. So a lot of times whenever we do these things,
Mm-hmm.
Do
Well,
we
one of the
do-
things
do-
that
do-
we're
do-
working on is we're debating right now we're actually looking at building a northern park,
Land swap.
a
yeah,
land
land
swap.
swap.
So if and when we do that, then we'll have to figure out the funding for that, and
Right.
that's when we can build that facility. The problem is going back and retrofitting the old facilities is you're just continually pumping money in there. So we'll still keep them at Art Park, but we'll build a newer facility potentially. But that's stuff that we're looking at right now. We haven't looked at it, to be honest with you, because we don't have the money to do anything.
Yeah, I get a lot of calls about that.
Yeah, I mean, we just bought some new lights there. The new lighting is coming
Yeah.
in. So, I mean, we're doing everything we can. It's just an old facility.
Because everyone sees what we're doing in Azalea and everywhere else. They're gonna, we gotta.
Yeah, Zay got a matching grant, so we're
Yeah.
we're doubling our dollars. Let's see. Other future budget concerns. 319 utility relocation expenses. As you know, in the 5-year plan, the widening of 319 to 4-laning 319 from the Leon County line to Walmart, basically, that's in the works, and it's in the 5-year plan. So therefore, we have miles of sewer line and water line in the right-of-way that we've got to relocate at our expense.
And I
as the
can
way it
assure you
stands
the
now.
other one will be shortly behind it.
Yes.
From Walmart
And then the
to
other one
Gulf
is
Coast.
behind it, so we're talking
But that's where
probably
the-
10 to 12 million dollars just for that section.
That's
Yeah.
where you're waiting to see if the state allows our,
For this one, yes. We can't guarantee that for the others, but we're waiting to see up here down at the intersection down here.
if they generally do one, generally speaking, they may do, which would save us millions of dollars.
Could we ask for a legislative appropriation next time that comes around?
We
Just
could.
for a one-time hit, like Halsey, put it in there to see if we can get money allocated to relocate utilities?
We can see. We'll do everything.
Maybe we should see if our next legislative priority, keep that in mind, that maybe that's one item we could put in there for,
They already passed that for depressed county.
right, I understand.
The problem is, we turned our financials in, and they're not as bad as they wanted them to be.
Maybe if we get 15 million on that, maybe we need to go down 7.
What if we raise the millage rate to 10
problem
mils?
with-
We probably
Well, I
get it
can
in.
tell you this, from looking at what the
Oh, we
governor
did it
has,
all right.
from looking at what the governor has shot down, vetoed, is a lot of projects like you're talking about, appropriations for going back and stuff inside the right-of-ways.
But this is
and
a Springs
legislative.
enhancement, though. This is totally different. You're looking at it all wrong.
Then the next one is fuel contamination cleanup, as we already talked about that. Then Restore Act funding, that's a possibility of mainly on the capital side, which it could be a positive or will be a positive. A fire and EMS facility, as you know, we're going to be announcing at this in an upcoming meeting on when we're going to move the firefighters into Station 8 for a temporary home, but we've got to have a fire and EMS facility because currently our folks are working out of trash and living and sleeping in trash conditions. So.
I know that
It's
Restore...
dangerous as well, I'm sorry about
And
that.
dangerous as well.
That Restore Act funding, I know this is not the time to discuss that thoroughly, but is there any way we could leverage that with what you were talking about, infrastructure uses, maybe to move the force main off? You know we're talking about running a new route, and then we won't have to relocate them, we could abandon them in place.
If we come up with, if it shows that we have a better way, that's a possibility, that's a stretch, but that's a possibility.
That money's for infrastructure, and if we could...
Yeah, but I mean, it's supposed to be for new infrastructure or retrofit of old one, like Panacea, fix old leaky stuff that's contaminating the ground.
Just a thought.
I know what you're saying. It could work, but that's a stretch.
Because, we need a new repump station for Crawfordville, because everything from Wakulla Springs to Walmart to the Flowers is all going to one lift station there at the park.
Mm-hmm.
You know this.
Yep. As I say, the fire EMS facility, also in road department, additional funding needs, just as we discussed. So that's it. That's all that's question and answers.
What about the revenue side? We talked a lot about the expense side. What's your
Revenue
assumptions?
side, currently, I've talked to Brad this morning, and it's way too early for them to have any type of prediction, but as far as our ad valorem, we put a 1% increase in, assuming that there'd be a 1% increase in the ad valorem.
What did we get this year? Is it
Negative.
flat, negative,
It was positive.
I thought we were negative.
just over what? Just over flat, okay. So 1% may not be, you're assuming a 1% increase, which construction's starting to pick back up, but I know we have to offset depreciation. What do we need to offset depreciation, Donnie? Increases in,
46, you said? 26.
we're at 14 year-to-date since October, so at least we're on track to offset depreciation. So we're at 14 from January 1?
Anything that was seen January 1, even if it was CO'd prior to January 1,
I'd like to see, if possible, on the revenue, if there are any revenue increases, we've got to wean ourselves off this jail bed revenue. That's a wild unknown. And my personal preference would be take any increases we have and start drawing down our reliance on that jail bed revenue. Use the jail bed revenue still for lift stations or whatever. It's still there. Don't just give it back to the sheriff or whatever. Still use it for capital projects, but we got to wean ourselves off of that somehow. Now, I know that would, you know what I mean. That's a huge unknown.
Mhm.
Sheriff, come on up.
Talking about the jail bed revenue, I guess all of you have seen the letter that David Harvey wrote 20 years ago that we need to wean ourselves off of this. And this has been going on for a long time. One thing I do want to mention now, the state is asking counties if they can hire or house state inmates and how many we can house. I haven't talked to Jared yet, but I'm thinking maybe if we can hire or house state inmates, we can provide 60 or 70 beds for them.
Can you mix those with the ICE inmates, or you gotta keep them separate?
No, I can mix them with locals.
Yeah.
I can put them in there with local inmates, but I can't mix them with ICE inmates.
Now, this isn't tied, Charlie, to the thing where they're making you keep the guys, state prisoners with 1 year left, and you don't get compensated for it, right? This is something different.
Right, this is
It's a
something
revenue
different.
increase.
Yeah, years ago, I don't remember, how long was it, Meridian, we used to house?
So 110, I think, that paid it away. The state did away with us housing.
And he was making revenue back then?
Yeah, because of cutback. Yeah, we were making about $450 a year.
And then also ICE too? Well, that would be nice. That would be helpful.
Well, with all the problems, and this is just in the preliminary stages, I just got this today, but with all the problems that they're having in state prisons now, I don't know if you've been reading about it, they're having a lot of problems, DOC's got a lot of problems. I think they're looking to put them out in county facilities where we can keep a closer eye on them.
I mean, if we had a more stable, if they had another source of revenue, I'm not saying at that point maybe we wouldn't need to try to switch it off to ad valorem, but if you assuming 400 and we budget 200, anything extra could use for county capital projects or whatever.
Yeah.
Or, rebuild their reserve and then use that, then spend that money. Then it's extra money.
Well, if it comes down to it and they do follow through on this and we do start housing, we're ready. We're shovel ready. Bring them on. We've got the correctional officers in there. We've got the food service and medical. Just bring them on.
Now, would they maximize the capacity at WCI?
40-50 is better than zero, though.
Yeah, it sure is. So, anyway, I'll keep you posted as that rocks along.
Look, Sheriff, so there is, in the past, there's a history of us being suggested to get out of the ICE. Is that what Sheriff Harvey's letter
And
was?
I've got a letter that he wrote in 1994 to the county commissioner said, it is time we've got to wean ourselves off of these ICE inmates.
He didn't say get out of it. He said stop relying on it to fund
That's
ongoing operations.
That's exactly right.
So I'm confused then, still under Sheriff Harvey, we greatly expanded the
I
jail.
don't know how that worked. I wasn't here then, but I'll be
At
glad-
that time, he was subsidizing the county. When he expanded and we had a great revenue.
That's
But you
correct.
can't go in
Everything
two
was great.
directions at the same time. You can't say, we got to get out of this, and at the same time pitch to build a bigger jail.
I don't
mean,
think he
there's
was saying to
something-
get out of it. I
Well,
think he was
even to
saying don't
reduce it.
rely on it.
He was saying
to run
don't
the sheriff.
rely on it. He foresaw
I
20
don't
years
know why we
ago
went
that this
and built
was
that
going to
big
be a
facility.
problem. And
That's confusing to me.
I don't think any of you were around 20 years ago on the commission, so we can bash them.
No, I'm not looking to bash them. I'm just trying to understand what the thinking was, and so we can go forward. Sometimes understanding the past helps us to move forward into the
That's
future.
correct. I will scan this letter and I'll send everybody a copy of
That
it.
prisoner's revenue has been subsidizing our millage rate for many, many
You
years.
bet.
Because if that profit wasn't there, then we would have to
Yes.
either A, make it up through cutting the sheriff's department.
Mhm.
You can always reduce expenses, or B, increasing revenue, which would be ad valorem taxes. So-
Until just recently, the program has subsidized the county taxpayer.
It has.
And by millions of dollars
has.
over the years
It
now.
has.
Right now, it gets a little scary because it's on the break even or whatever.
That's correct.
Another downside to it is just like Charlie said, they have the capacity today to handle 60 more prisoners. Our expenses probably wouldn't go up.
No.
Now, on the downside of that, if you lose 50 prisoners, our expenses don't go down either. So you're still paying that same amount. So
The only
that's
expense
a
I can think
variable
of
thing.
right now, the only expense that would go up is our meal expense, $1.30
I
a day
understand,
we're
but if
paying
you
now.
lose enough of the ICE prisoners where you're just barely breaking even, there's a fixed cost there to have those ICE prisoners. And even if you lose 10 or 20 ICE prisoners, the expenses don't go down by that same amount. the flip side is true too, that if you add 10 or 20, the revenue goes up, but the costs don't go up the same. So that's,
It's not
that
as,
was the big gamble back in the day, is
it's
hopefully
not as
that's
though
the
you
same.
can just go out and arrest people to fill the beds.
No.
It's what it is.
It's what it is. It's, I mean, there's detainees running free all over the place, but they're not picking them up.
And these aren't guys, they got out of tomato fields in Quincy or something. Jared showed me around. These are dangerous guys.
Oh, these
nice
guys will kill you in a heartbeat. You go back there and we lock you in that pod with them, you're going to be dead in a couple of hours.
And the Correctional Institute will not take these people.
No.
You've got to be approved and a gold-plated prisoner to get over to correctional. Is that not?
You talking about the ICE people?
Yes, over on the east part of the county, whatever you call it. Is that what you call it?
WCI, that's
Yeah.
state.
Yeah. Well, yeah, okay.
Yeah, that's state, and they're not going to
Yeah.
take them. There's been a misconception. Some people call these ICE people ICE inmates or ICE convicts. They're detainees. These people have been in this country illegally. They have come over here and they broke the law. They've already served their time with the federal government. They're waiting to be deported back to their home country. This is why they're moving back and forth all the time. But we've seen instances where we take them and put them on a bus at the Greyhound bus station to get them away from here.
Some of them may not want to go back to their home country. and face
Most
charges
of
there.
them don't want to go back to their home country. We had one guy, was that a couple of years ago, Jared, the guy was Russian? He did not want to go back to Russia because they were going to kill him when he got back. And he stayed in the jail over here for 2 years, and because he knew they were going to kill him. We've got others over there, the Jamaicans and Haitians and Cubans and Chinese and you name it, we got them. But most of them don't want to go back.
Don't blame them.
Thank you.
Well, the prison at Wakulla is a faith and character-based prison. You have to be a hand-picked certain classification.
It is.
To even be at that prison. So if you get one from another prison, technically it was not nearly based on what Wakulla can house or anything.
Right. It's faith and character based, and they even got a military unit over there of veterans. But what a lot of people about this prison out here at WCI is that's the second largest prison in the state. There's 4,000 inmates out there, 900 of them doing life sentences. So, but that is the second largest prison in the state. I think, what do y'all got, 1,500 down there at Franklin?
We got 1,500 at Franklin, and on any given time, there's on a shift, there's about 25 people watching 1,500 inmates.
That's a
And
shame.
That's another.
That is.
And that's another reason that I think that they would be looking at, like we was talking about, other inmates coming to the state, which of course I haven't looked at the email you had, but at any given time you probably got about 25 officers on a shift, and that's during day shift. On the evening shift, it's maybe even less than that. You got about 20 now. If you're to work camp, you got 500 inmates, maybe 10 officers watching.
That's
500 inmates.
and they're having a hard time hiring these officers because of the benefits. They're having a very hard time, and I feel for DOC. I mean, they're in a tougher situation we are. Thank you.
Thank you.
Any other questions?
I got another expense increase you may not have even heard about yet.
You always do.
I met Friday with the Board of Trustees with the Florida Association of Counties Trust, and our premiums are going to go up 4% on that. We met
Is that
with...
about average? About average.
Okay. We met, I don't think it went up last year, did it? Did it skip a year?
It did go up last year.
Okay. We met with the actuary, we met with the accounting firm. Collectively, they recommended an 8.4 increase, and we held it at 4%.
Well, we've got our revenues are up a little bit, like in PST. The problem is, you know, we're scaling back on local services tax, communication service tax. That's going to eventually go to nothing. So we got a big obligation there. But other than that, all the rest of our revenues seem to be holding firm. There's none of them jumping, but they're holding firm. And the legislative offset was down last year as well. So we're budgeting less this year in legislative offset.
On the health insurance, basically the way it seems to me, you're saying that we will pick up 100% up to 5% increase. Why don't we stay at the 80-20 and we just split the 5%? Otherwise, we're at 80-20. we're at 80-20, and you're saying that we'll pick up 5% more. Why don't we do 80-20 on the total thing, and not?
Well, I understand what you're saying. In the past, the counties picked up the total increase.
That was an error also.
That's what I'm saying. What I'm saying is we need to step back from that now.
Yeah.
And we need to cap it somewhere. And
Well,
5% may not be it. It may be 8, maybe 5, maybe 10. I
Well,
don't
let's
know.
not worry about it. Let's stay at 80-20.
That's a possibility. If you want to do that, we
It's
can
up
run
to
those
us.
numbers
I
and
mean,
see.
we collectively decide that.
I would
That's right.
love to see us stay at the same ratio. Then, if it were to come down, which it never will, but if it goes up, it's going to be what it's going to be. We have no choice on that. But everybody stays the same. The county taxpayers stay at 80%. The employees stay at 20%. Whatever it may be, and we can always do our best to maintain that.
The problem is from a staff point of view, when the cost of living is going up, and we're not giving cost of living increases, they're actually losing money year after year. They're not even holding par
That's the
with the
concern. That's kind of where my concern's coming in.
Well, we're gonna-
I don't want to cause any undue pressure on our staff either. If we're not giving the raises, but we're also capping another thing, then they're gonna watch their paycheck go down instead of even stay the same or go up.
Well, we're staying at 80-20. Everybody shares the burden, and
Well-
we should accommodate our staff. I'm not saying anything about that. We should accommodate our staff. It's a great place to work, great place to live, and they should be, I don't think they've had an increase in 3 years. And that's really bad. They've slid down probably 3 or 4%. But we should probably make that up. But you have to, this insurance is a crazy thing. It'll bankrupt you. Two or three departments in the county will absolutely bankrupt you if you don't keep your hand on them.
Howard?
Yeah, and the ultimate, this money all comes from the taxpayers. And so, we can be as generous as we want to be, but the bottom line is, it's the taxpayers who are spending this money, and I think we just have to keep that in perspective.
Well,
as
and also, and I agree with your 80-20, but understand if you've got an employee that's been here 10, 15 years, and that ratio now is 85-15, and all of a sudden we adjust it back to 80-20, we're hitting them with a big ticket.
You're hitting the county also when
I understand. I'm just telling you.
But I'm just telling you, when you put the other 5%, you're putting 5% over on the county. That's what you're doing.
It beats what we've done in the past, which is all of it.
Well,
The key is we don't know the numbers right now, so, we could solve the problem without knowing the numbers,
Right,
and
if it
then
comes
the
at a
problem's gonna
5%
change when we
increase,
do
then
know
we
the
can
numbers.
absorb that, but,
Yeah.
it comes a point where you can only pay so much, and you've got to say, I gotta stop and make that value X, and base it on X, and then you go from there, and it's brutal, but you gotta do it.
I compliment you on doing that. You've said that, but basically speaking, I don't want to pass the 5% onto the citizens. We all share the burden.
Passed 8 last year.
Pardon?
Passed 8 last year.
Well, not going to do it. I'm not going to do it this year.
He didn't
And I'm
vote-
saying cut it.
He didn't
I'm
vote
saying
for the
cut
budget last
it.
I ran the numbers at $1,000 a month premium, which I think is probably realistic. The county pays $800, the individual pays $2. If it goes up 8%, that adds to $1,080 a year, right?
Mhm.
That means the county's part's $864, the employee's part's $216, and that equates to basically a 7.4% increase for both, if you just do a flat 80-20. Now, if you did a 5% cap, the employee would pick up 5%, and the county would be subsidizing another 2.4, basically.
No, it's a 5%. The county picks up the 5%.
I understand, but instead of the employees going up 7.4%, it would only go up 5. Right? Instead of the employee's portion out of their paycheck going up 7.4%, it would only go up 5.
Right.
And then they would be responsible. Their paycheck would be decreased by that 2.4, which is the difference between the two.
Mhm.
And that's fine with me. I understand why you're doing it. Just to try to keep to make it easier to budget for it.
Well, there's a balance between an employee benefit and being physically responsible, and that's a delicate balance. And I feel like that we have to do something to become physically more responsible, and you can't just continue to pay an absorbent health care, especially when not all your employees are on CHP. Because realize not every employee is on CHP or on our insurance program. Okay, so we're saying to all those employees that have they're on their spouse's insurance or whatever, we're penalizing you because we got to pay for all these people.
Another good example would be you got an employee comes to you, says, David, I can get on my wife's health insurance and save you $800 a month.
That's right.
Will you give me any more money if I do that? You
Yeah,
can't do it.
They get a
whatever that thing
they get
is.
$2,500 a year.
For that, but it's saving the county $9,600 a year.
Right, that's right.
But that's in a cafe plan, right? That's not
No.
money they can.
No, that's money it's a flex program. They have to bring.
But it's spent
we
on
got a
health care
company.
expenses. You can't go
Healthcare
buy a car. with it.
related expenses.
That's what
Right.
I'm saying.
That's right.
It's not money in their pocket.
No.
It's money to offset, and that's
Right.
the quandary about it. Because theoretically, and I know why you don't do that, but you would want. And I remember this from having Cleve's job. He's not here for me to talk to him about. You want the best way for you is to have as few people as possible on health insurance, because that's $800 a month the county doesn't have to pay. But you don't want people getting off of it to get more money, because then they'll get sick and they won't be able to go to work.
I think health insurance is great. We have great, and we need to continue to have great programs to attract employees. But also, you've got to be careful. You can only increase this thing so much, and it will break the bank. You cannot just continue to
I
pay.
understand. You're telling Jessica, I don't know, let's say she's on Todd's insurance,
Right.
and you're saying you're not going to get a raise because we got to cover everybody else's health
Right.
insurance raises, so you
Exactly.
don't get a raise. And I'm
Exactly.
not singling you out. I'm just using it for example.
Well, that's a very good example. All of a sudden, we're paying all this, and the guy or Jessica, she's got she's on her husband's insurance. She's like, well, why are you penalizing me because of them?
I just don't want to pass 5% over to the citizens. I'll pass basically 80% of that across. That's what you're saying.
We can run those numbers and see.
Well, 80% is better than 100%. And right now we're talking about 100%.
Well, 100% of 5%.
Exactly. Not 100% of 100%.
Okay. All right. Any other questions?
Time for a cheeseburger.
Yeah, you can break about 30 minutes before we come.
All right.
No further questions?
Donnie, you got anything? You got any wisdom? Cheryl?
Yeah.
Huh? Oh, okay. Buddy?
Anyone?
So, just on an overall, how do we, as a county, try to get a handle on how much is the appropriate amount of money for any portion of the budget, such as a constitutional officer?
Say again now?
Yeah. So we go year to year and we say, okay, we got to raise this thing up by 5% or whatever increases we do, or decreases when things were really bad. But is there a way that we can review? Is there a way that we can look at the budget of a constitutional, and how do we make that determination? Do we make the determination on how much money we have at hand, and do we want to increase our millage rate, or we want to increase our utility tax or whatever else in order to have more revenue coming in and say, okay, there's more revenue now? Or do we look at what's needed in order to run the different departments and constitutional officers?
Well, I think it and Donnie and Cheryl and Buddy and Charlie's not here, but that a constitutional is elected with, and his fiduciary responsibility is to manage the money that is properly managed, the money that is delegated to him. It's still the people's money, but yet he has that fiduciary responsibility, and you guys have the ability to say, here's the money that we're going to be assigning you. How he spends that money, or he or she, excuse me, Cheryl, spends that money is totally up to them. They can share their budget with you. We get copies of budgets, but that's it. As far as all we do is get them and put them in a book. We don't analyze them as to whether they're accurate. All we do is say, here, you know, the balances. There's nothing from my standpoint, I can't go in and say that, and only thing you guys do, you can set the budgets and say, here's what percentage of revenue you're gonna have. And then you gotta fight it out with the constitutional, because all y'all are constitutional.
This goes back to that discussion we had several months ago about the fundamental principle. Is it constitutionalists tell us how much money they need and we have to figure out how to come up with it? Or do we tell the constitutionals, here's how much money you got, and they gotta figure out how to make it work? Now, we've
that was
worked
my
together
question.
in the past with it when we've cut, you know, we've shared the cuts for the most part. But that's the fundamental question.
Yep, that's what I was asking.
And I think it's the latter. Here's how much money we got, you make it
That's
work.
what, yeah, and that, you know, that's all gotta be fair across the board, but you're right, at the end of the day, it is, you only got a certain amount of money to work with, and you can only dole it out so many ways.
Now, let me
And
take-
and the problem is, you're all fiduciarily responsible, so am I as well as you guys, to make sure everything is funded. So it's not just the constitutionals in this game. You gotta treat, just like I tell you, I gotta treat, you know, we gotta treat the sheriff just like we do, you know, the little bit of money we give the health department. It's all the same. We're fiduciary bound for all of that.
And let me throw in one qualifier. I think Donnie's budget, Donnie, yours is approved by the state, right? And we have to fund that, basically. So his,
Yeah, I got it.
and the sheriff can always appeal his budget to the cabinet. So, and they could say, that's what you gotta fund that. Now, I don't know about Buddy, and yours the same way, Buddy?
Well, yes, but I have done, research with counties that are our size. There's only one county in Florida, and that's Okeechobee, that is literally almost the same when it comes to voters. Our budget here is probably, they put right at $100,000 less than theirs.
Mm-hmm.
You know,
Nobody's talking about cutting you. We're just,
No, I'm just telling you.
okay.
You look at cost per voter.
Mm-hmm.
Matter of fact, I did Leon County. They run at $23.80 a voter. We're at $12 a voter when it comes to actual money.
And as long as everybody's working together and, you know, there's plenty of revenue and there's no problems, it's a non-issue. It's when there's not plenty of revenue that
Well, and that's the reason what we've done and what we started last year and done is assign based upon if there's any funds that are left over, and is we assign a percentage based on your portion of the budget. And it worked well last year.
And that's a recent development.
Huh?
Started doing that. We just started doing that.
Started doing that, and that worked well last year. We actually gave the sheriff's department more than our 50%. But, you know, I suggest we do the same thing this year, and that's something I'm going to put in here, and, you know, it is what it is. And if anybody don't like it, that's just too bad. Here's your percentage increase, and here's all the funds there is. Now, if you want to increase, if you want to build something, go cut your personnel expense and build it, or whatever you want to do. Cut out something else and go build what you need to build.
Well, we've also established they each have their own fund balance, that any money they save
Exactly.
goes into their you know what I
Right.
mean. Their
That's right. Each one of them now can have to operate it as a small business.
Cheryl's stretching or wanted to say something?
No, admit, Cheryl, you make more money than anybody around here, so go ahead. As far as bringing back to the county.
I don't think that's what you meant.
Tax collector. They talk about her in the Bible. Kind of like the school system. It's easy to justify taxes going to the schools and law enforcement.
It's half their tax bill, and you think it'd be zero of their tax bill.
Mm-hmm. That's a good point.
That was probably the most intelligent thing said here in a while.
Any other comments from the board?
Cheeseburger time.
Motion to adjourn?
Second.
Or adjourn.
I'm gonna try to get there and back 30 minutes.